So it is my pleasure to welcome you today for our webinar on community level interventions to address obesity. And I just wanted to share before we start what we have planned for you today. So first of all, I'm Olivia Brata Cavalcanti. I'm the Director of Science and Education at the World Obesity Federation. And after we start doing some very high-level introductions, we'll be joined by our UNICEF colleagues, Susan Arts and Joe Duell, to talk about our Friendly Cities initiative. They will be followed by Sarah Hickey from Guys and St. Thomas charity, and they will be talking about how to address childhood obesity in urban environments. And they will specifically share with us a case study of the London boroughs of Lambeth and Southwark. We will then have Dr. Goenka from the Public Health Foundation of India will be sharing with us lessons to be learned from India regarding the built environment and levels of physical activity and obesity prevention. And finally, my colleagues, Marco and Leslie, will be speaking about the World Obesity Federation's recommendations to this topic. And we'll have some time at the end, hopefully, for some Q&A. So before we start going into no more detail of what we have planned today, I just wanted to take a moment to acknowledge the importance of the theme of today's webinars. And that is because it couples the very high prevalence of obesity that we currently have with the importance of addressing this problem at the city and community level. And that's mainly because urbanization is one of the drivers of obesity, and it has very specific impact on BMI, hence in obesity. And people living in cities have a much more difficult time in accessing just healthy lifestyles and choices. And that's not only about unhealthy diets and sedentary lifestyles, but they're also exposed to air pollution and many other things like stress, which has an effect on our sleep, all the different kind of drivers of obesity, which are many and very complex. We also need to remember that by 2050, over 68% of the world population will be living in cities. So it is very important for us now to start preparing the kind of next generation obesity interventions. So before we get into the meat of today's presentations, I just wanted to share with you some housekeeping rules. Please, if you can all be muted, and if you can just take the time to double check that now, that really avoids any echo problems. You are free to ask any questions throughout the presentations. You have a chat box to your right, and you can write them down, and we're going to try to address all of the questions right after the presentations. If we don't have time, we'll try to address them at the end at our Q&A time. And finally, just remember that this webinar will be recorded. And on top of this very important topic that we're going to be focusing on today, World Obesity Federation also has many other policy dossiers on our website. You can find the link here. And I really encourage you to take a look on the different topics that we have there, and they really provide a good summary of evidence and different kind of resources to help you change policy in your country. So without further ado, I wanted to pass the mic to our colleagues at UNICEF, Jean Ertz and John Jewell, for their talk on child-friendly cities.
Thank you very much. Jens and I are going to be sharing this presentation on behalf of UNICEF. As you are aware, we are a mixed specialist team coming from the urban but also the nutrition space, and we wanted to use this opportunity to provide some insights into some existing work and thoughts that have gone into the urban agenda as it relates to overweight and obesity prevention and healthy diets, and also provide some hints about the directions that we're going to take moving forward. And so I'm going to start with a little bit of context as to why this is becoming a priority for UNICEF, and then Jens is going to bring in the perspective from the urban and talk about especially how UNICEF can bring added value in this space given our comparative advantage focusing on children, the fulfillment of their rights, and also making sure that children are heard and are at the center of decisions that affect their lives. And finally, we'll just provide some insights into some upcoming collaboration with partners, and some of the plans we have moving forward. Next slide, please. So, as many of you hopefully have seen, recently in October, we launched the State of the World's Children publication, focusing on children, food and nutrition, with really a sort of like a intention to the changing world and the changing forms of malnutrition that we face. The State of the World's Children is UNICEF's flagship report, and it's an annual report that is published and focuses on a different issue affecting children's rights and children's well-being each year. And this was the first time that it had looked at the issue of food and nutrition in 20 years. And so you can obviously see that, or you can imagine that the issues facing children in the world as it relates to malnutrition in its all forms have changed quite significantly in the recent 20 years. So what this report looked at was, what are the main issues, how have they changed, what do we need to do in response, and what would an agenda to put children's nutrition look like. Next slide, please. And what this report found was that the situation is extremely concerning, and despite the fact that we have seen some progress on some forms of malnutrition, we've seen quite significant declines in stunting, we still have a major burden of stunting. We have persistent high rates of wasting in some parts of the world, and then we have, since the previous report, we've seen this rapid rise in overweight and obesity across all regions of the world. And what we did was looked at combining these indicators, like combining the data that we have around stunting, wasting, and overweight, to look at, what is the burden of children not growing well, and where are these concentrated? And you can see in the map here that, we came to the conclusion that approximately 1 in 3 children worldwide are not growing well. And this is in part related to many complex factors. Many factors affect the nutritional status of the world, but since the previous report 20 years ago, some of the factors that are driving this issue of malnutrition and persistent challenge of malnutrition include globalization, climate change and emergencies that are affecting food and nutrition security, but also urbanization. That's a clear sort of change in the previous 20 years that we've seen this increase in urbanization. That's an increasingly important factor. And combined, these are leading to worsening nutritional prospects for children. And what we sort of summarize it is that millions of children are not getting enough of the right food, and millions of children are eating too much of the wrong food in many ways. Next slide, please. And we also wanted to communicate as well that the overweight and obesity is not an issue that is confined to high-income countries. And to many on this call, that is not news, but it's still a message that we need to communicate strongly to policymakers and the public at large. And you can see here that the increase in overweight and obesity has been very steep in lower middle income countries. And in fact, when you look at the data for under 5s, you can see that almost 3/4 of the population that are overweight or obese in the world are concentrated in middle income countries. So really, that's where we as UNICEF and we as people working on sustainable development need to be thinking about our efforts. Next slide, please. And this is based on some previous work, but it's also focused, it's also sort of profiled very clearly in the State of the World's Children, is that we need to take action on food systems. We need to make sure that food systems put children at the heart of every decision that affects them. And we need to think all the way from the food supply chains through to the behaviors of caregivers, but a really important component are these personal food environments and the external food environments. So what is the availability, affordability, and also the promotion of foods in the environment that are affecting children, that children are exposed to, that influences the nutritional quality of their diet. So for UNICEF, one of the key messages from the State of the World's Children is that food systems need to deliver for children, and food suppliers and actors in the food supply chain need to do better for children. Next slide, please. But what we also wanted to draw attention to is, yes, the food system is integral, and actions around the food system are extremely important to make changes for all forms of malnutrition and to prevent overweight and obesity. But we also need to mobilize supportive actions in multiple different systems as well. So we need to think about, what can the health system do? What can the education system do? What can water and sanitation do, and social protection? How can these be leveraged as well to support and improve nutrition? And in the case of overweight and obesity, how can these systems also contribute? And so I think one of the points here is that in the urban setting, there's a very nice ability to also reflect upon what can we do in the urban setting on the food system, and what can we do in the urban setting to mobilize different systems to take action. Next slide, please. Over to you, Jens.
Yeah, thank you, Joe. So good morning. My name is Jens Arts, and I wanted to continue the presentation more highlighting also our work on urban settings. As you might not know, is UNICEF has not been working specifically on cities recent years, but that is changing. So in our current strategic plan, we have highlighted two very clear output statements that UNICEF wants to invest in two things. In what we call goal area safe and clean environment, which reflects on the environments as Joe described, but also on the physical environments. Is first of all, we want to have better data on intra-urban disparities, because we feel like, and that's also known amongst urban scholars, but it has to be again emphasized that if we talk about the poorest children or the most deprived children and communities, they of course live in specific areas in cities that maybe on an average level are not seen as poor cities. And so we want to have more data on intra-urban disparities, also for having being able to better prepare programs, nutrition programs. And second, that we also want to see countries really developing urban plans that are child responsive and that involve participation of children. That, for our understanding, is something that is also part of the solution to deliver actually on these food environments, but also on the other sectors described by Joe. Yes, and so within UNICEF, we have developed also a strategic plan how we would be able to deliver on these two outputs described in the previous slide. And we want to, of course, continue working on quality social services that includes nutrition, but we also want to emphasize that we want to promote a safe and clean urban environment for children, which is part of the solution, also reflects as part of the solutions to address obesity, that we want to see participation of children very much upfront from in all steps of the process, that we want to see more evidence strengthening, that we can really talk about which parts in cities, what are exactly the bottlenecks, and we also want to see urban planning happening in a different way. In the next slide, I will explain more on that last component of urban planning. Next slide. So we have developed a handbook on child responsive urban planning for urban planning stakeholders to explain that their investment into looking at children's need for specific child related spaces, but also to engage them into urban planning, and also to use all the data that they have at hand to better have knowledge about children's behavior, but also children's situation in cities is very important. And we have gathered the handbook around 10 chapters, and these chapters actually reflect in a way how an urban system works. And so you will see that amongst the 10 principles, you will see what is relevant for this webinar is that we have highlighted the importance of planning food systems that are composed by farms, markets, vendors that give access to healthy, affordable, and sustainable produced food and nutrition for children. But we also, for example, the need to call for sustainable transportation systems, which is also very important as a part of the solution to have increased physical activity amongst children. Next slide. And what is important is that we also want to reflect upon how a city is not only a supply system, that indeed has potentially a big power to be shaped and designed by us, by urban stakeholders and experts, but it's also an environment, of course, where behaviors are adopted, and so that's very important for us to include children in decision making, because they grow up to the adults that will actually run all these cities that also have been present in 2050. There's going to be so many people living in cities. It's the children from today that will run these cities, and so already engaging them in the design, the planning, and the understanding of that also urban food systems in a way are planned and can be improved will ensure that they will be the leaders of tomorrow. Next slide. And planning for us, it's three things, and we see that there's a major agenda for the international community and for expert organizations, and this goes beyond the topic of food environments, but we think there's a massive need to plan spaces better. So we need much better norms and standards for planning, building, and management. And these spaces also include spaces for food production and distribution. As said, also that there has to be much better confidence and tools for experts to work with children. And of course, that's something that we want to, as UNICEF, take on our side to develop these participatory tools that everybody feels comfortable to include children in a proper way. And thirdly, to also see how everybody's collection and production of data can be better used to make child-centered decision making. Next slide. And I'm practically just focusing a little bit on these two areas that are relevant for the webinar today. So we have developed one chapter on food system together with EAT, our partner, and where we have described how these principles of planning, so providing space for food, participating with children into food production and distribution and cooking, for example, and also how food evidence around food could also be gathered in cities and being meaningful for children. And so this is the principle 7 that we described in the handbook. Next slide. We'll explain a bit. Every chapter explains or highlights again why it is so important to plan. And I think everybody might somehow notice that urban planning is not delivering on one specific area. It's more like a policy environment that supports different kind of sectors. So, for example, it delivers on health, and that, of course, a good planning of cities delivers in the case of nutrition and food. It can provide better access to nutritious, balanced, and diversified diets. From a more safety perspective, if cities are more knowledgeable and managed to have short chain food production, there will be less food insecurity and food stress. From more a community perspective, it's also something where communities really can gather and also continue cultural habits to cook, to grow food, something that's seen often in cities as something where citizens also really unify and have a common language and a common interest. And of course, in terms of environmental sustainability, there's a lot of thinking to go to what do we do with our food waste, which is one of the major parts of waste in cities often. And of course, also from more like a prosperity or a financing level, having access to healthy food, of course, will reduce public health costs. And then in the handbook, we also described concepts and strategies that are meaningful to include children, to plan the proximity of sustainable urban food locations. And we should, as UNICEF, of course, focus on schools also, that we feel like schools are entry points to deliver this healthy food. That fostering processes where communities are engaged in supporting urban farming and urban agriculture more broadly is important. And then also our focus, or also our experience to leverage actually the private partnerships, the private sector, to create healthier food is very important, because influencing how retail is organized and how marketing is also organized and sometimes limited to not influence, to have a good influence mechanism to children towards healthy food is very important from a private sector perspective. Next slide. Well, for example, an example I often find very remarkable is some historic cities like this one in Barcelona. They have always had this tradition to have proximity of access to fresh food markets, and it's very famous, but it's also really delivering on having access to healthy food, and so it really is also translated into urban planning regulations. So that's something that we think is very useful to look at which other cities are doing this, and then in particular, for example, around school areas, how regulation to access to fresh and healthy food is managed. Next slide. And of course also how to design infrastructure like schools in a more holistic way, and to see how schools can be places where children have a very close contact, but also really an exposure and opportunity to learn about healthy food is very important. This is an example of a kindergarten in Vietnam. It's not a UNICEF project, I want to emphasize, but it's something that we look at as very inspiring as an example for schools in the world. Next slide. And then the other area of sustainable mobility, emphasizing that in the planning of cities, which can contribute to better physical activity, is very important. We in UNICEF we don't have now an explicit program on physical activity, but we are aware of this, that we should emphasize this more. We have a current program that looks at road safety, and there's a major understanding that we have to look at sustainable transportation, active transportation, walking and biking, and public transportation to also enhance road safety. And so we will also see that this area is something we want to invest in. And again, the child perspective is so logic to again start from schools, for example, where emphasizing not only the curriculum in schools, that physical activity and safe journeys to school are important and could be seen as a child right, but also that it's so important to deliver on physical activity to reduce obesity. Next slide. And there also we have I'm not going to go in detail because I think I'm running out of time, but there's also an explanation about what are actually the impact areas if we invest into sustainable mobility and physical activity, and what are main strategies that we can put forward from a child perspective. Next slide. Yeah, these are examples that we see happening in the world, and organizations that we want to partner with more, where there's a lot of emphasis now in redesigning streets that are more focusing on active transportation, and that will also be a part of the solution to address obesity, and where also the events that are happening when these kind of new places are inaugurated can also be places to disseminate the message, and to see these events as places, as moments to promote healthy behaviors in cities. Next slide. And that's not only about infrastructure, but again about also giving the opportunity to children to actually learn to have access to active transportation. And this is a very nice example that we are following a bit in Tirana in Albania, where the city is not only investing in infrastructure, but also really listening to children's voice and also giving them the opportunity to learn to bike, to have the confidence to become the future bikers of the city. Next slide. And I wanted to briefly also explain that we have a child-friendly cities initiative platform, and this is the website childfriendlycities.org. That is a very interesting website that you can look at, and where there's a lot of good practices that we have gathered and that we also use to support cities, and where cities can engage with UNICEF to become a child-friendly city. We have relaunched, revitalized this initiative that is actually 20 years old, but there was a bit, let's say, it was not very coordinated on a global level. And so we have organized a Child-Friendly City Summit last October, actually, in Cologne, where we have gathered a lot of cities. There were more than 800 participants from all over the world to actually think about how the child-friendly cities can be a vehicle, an initiative to promote not only child rights, more general and from a participation perspective, but to really can use it as a platform to deliver on healthy, safe, and climate resilient cities. The next slide. And so the Child-Friendly Cities Initiative, it's an initiative that has a very clear vision to say that that actually, well, it's translating the child rights on a local level, but it's also trying to emphasizing that when cities look at children as the main and the most important citizen, that they will also deliver the full potential of cities. Next slide. And we do this, as I said, to fulfill, to actually we sensitize the cities to use their system of local governance to commit to fulfilling the child rights. Next slide. And we use it as a process. It's not a kind of labeling mechanism, but it's a process where cities go through different steps. I will explain that in the next slide. Sorry, the next slide. Okay, that's also interesting to know where we are now with the Child-Friendly Cities Initiative, where we have engagement in more than 40 countries, where we have had a very remarkable growth the last 3 years, where there's a lot of interest of countries or cities particular to join, and where we potentially reach out to more than 40 million children now. And so you can see on the map, for example, there's a lot of cities in Europe that have engaged previously, and also in Latin America, and you have now new big countries that are in the design phase, such as United States, but also China. The next slide. And so this is the process that I previously explained briefly. So where we engage with cities to do a specific child rights situation analysis that could, for example, have a specific focus on food and obesity issues. And then based on that analysis, we develop an action plan. We follow the implementation through monitoring and evaluation. And then we also have a recognition process already. And so then coming down to our current status, how we see developing this urban food agenda. As said, we are, it's new for us to work on a city level. So it's for us very important to work with partners such as city networks. We have a recent partnership with UCLG. Of course, we are also very happy to join this forum and other city network forums. We also will work very much with EAT, that I will also talk about a little bit now. So where we want to actually look at three things. We want to enhance the knowledge and the knowledge sharing. Also for ourselves to learn better what policymakers and decision makers are doing, and how we can disseminate good practices to prevent childhood overweight and obesity. Of course, our focus is on low and middle income countries, but also, as Joe has said, there has to be a lot of advocacy done to highlight that this is really a problem also in low and middle income countries. But so we also have to come up with tools that we can support policymakers with, that are convinced that this is a major issue. Of course, there has also we need also to acknowledge that it's a very complex issue, so that we have to look at it from a systems perspective. As Joe has explained, it's not only about nutrition, it's also linked with all these other sectors. And then we have to look at, we have to determine which drivers in cities can be influenced, such as urban planning, but also others. And so that we have to find, we have to definitely better investigate and also determine what are the multi-sector and scalable overweight prevention interventions and policies that have to be promoted. And so next slide, what we're doing now is well, setting the agenda, I think, also within UNICEF and amongst organizations that are used to work with children. And on the summit that I just explained, we have done a great session with EAT. It's a co-create session with young people that were very active during that summit, where we, for example, have developed with 20 of them policy recommendations about specifically how food environments in cities could be more healthy, and also more broadly how physical activity could be improved. And next slide. And we have also run on that summit a session on urban food environments, and where we have actually translated and discussed with experts what cities exactly can do. So that's where we are now. We are stepping into that area. We are using our platform, the Child Friendly Cities Initiative, to reach out to children in the world and to look to this, to open this conversation with local governments. And so that's where we are. And we are very keen to learn from other experts to take this forward in our programs in low and middle income countries. Thank you.
Thank you very much for a very interesting presentation. We also received the question that we already wrote down, and we're going to keep it for the end, as we are already a little bit late on time. We'll now continue to talk about childhood obesity in cities, as we're lucky to have Sarah Hickey, the former director for Guys and St. Thomas's Charity Childhood Obesity Program.
Yes, hi everyone. My name is Sarah Hickey. I'm the program director for a child obesity program at an organisation called Guys and St. Thomas's Charity. And who we are is one of the UK's largest and oldest charitable foundations. And we use our philanthropic capital to work on issues to do with health in inner cities, urban health. And the way we do that is by focusing in on a small number of complex major health challenges that are faced by people in inner city areas, and we stick with them over time. And we talk about trying to be evidence-led and evidence-creating, and what we mean by that partly is we try and use our particular geography, which is an area within inner city London of about 600,000 people, called, well, it's two areas actually, called Lambeth and Southwark. And what we try and do is to take an international evidence base on a particular issue, apply it locally, and then share what we learn from that local application. So that's the context of our organisation and our 10-year child obesity programme here. So child obesity here, I think, exemplifies some of the trends in child obesity much more widely. So as you probably know, London has relatively high rates of child obesity. Our area in particular does. So the prevalence is very high. The prevalence is very linked to deprivation and income. So high prevalence, but huge variation, which sits alongside a huge variation in income in the city and in our area. And the issue has huge, both social costs, but also economic costs. So within that context, the goal of our organisation's particular programme is to tackle what we call the childhood obesity inequality gap. So how do we get at and try and tackle this really strong link that child obesity seems to have with income and deprivation? And just to give you a bit more sense of what that looks like here, so this map is a map of our area. As I said, it's about 600,000 people. The map on the left maps child obesity rates across that area, the red being the areas of particularly high rates, and the more green, the lower the rates. So I guess what you can see from that is actually quite a big variation in rates. So in the darkest green, I think about 1 in 5 children is overweight or obese. In the middle darkest red, it's about 1 in 2. So quite a big variation there. And then the map on the right is the median household income across areas. So the red is where the more red, the lower the average income, and the more green, the higher. And I suppose, again, what you see here is huge income inequality, huge variation in income inequality, and also that the two map quite closely together. So what we see is this corridor across our area, which is a concentration both of lower income, and also higher child obesity rates. And this is just another example of that. So the two areas, Lambeth and Southwark. Southwark is particularly extreme, both in terms of its variation in income and its variation in child obesity. And our particular goal is to try and close that gap. So how do we bring the child obesity rates in the lower income areas down to closely match the rates in the higher income areas? Because what we hope is if we can demonstrate impact on that here, maybe we can get at some of the kind of underlying cruxes of the issue of child obesity and the drivers behind it increasingly going up in urban areas. So how we do that, our approach and focus is on food environments. So our mission, I suppose, in everything we do is to try and create equal access to food environments, equal access to food environments that enable and incentivize nutritious diets. And what we mean by that is positively transforming the food options in the spaces that children and families spend their time, which we kind of bucketed into homes, schools and streets. The reason we took this focus is a mix of looking at the evidence base and also a lot of research with children and families themselves in our area. And I suppose our reading of the international evidence base was, similar to what Jens and Joe were saying, lots of drivers of child obesity and eating behaviours and whether people eat healthy or not, but a really strong driver being the spaces and environments and food systems that influence those that sit around children and how well or not they enable people to eat well or encourage alternatively them to eat really badly. So that's our absolute focus in our programme, with a focus on changing food environments here in our area. What that means in practice is us doing a lot of work in that corridor that I spoke about. I've got a video here as well. I'll see if this one works. It's a clip from a longer video, which I can share the link with, just to give you a bit more of a sense of what the food environments look like from the perspective of children and families in our area. I guess I'll share the link afterwards, but I suppose what comes across really strongly from this is quite complementary to the evidence base suggesting that food environments matter. Because what you've got in this video is a sample of families who very much care about, obviously, their children's happiness and health. but what they face is competing barriers to providing nutritious diets to themselves and their children, and those barriers being time, being money, being bombarded by options that are less healthy, with a deficit of options that kind of meet their needs for time, so for convenience, tastiness, affordability, but also health. So again, that's what drove us at in this organisation to focus on food environments. The way that we work is by seeking partnerships in everything we do. So we don't deliver much at all ourselves as a philanthropic institution. What we do is seek partnerships where we can provide funding and complementary support to carry out actions that add up to a cumulative positive impact on the food environments in our area. And three things I think we really look for from our partnerships. One is the opportunity to build on and create new evidence. I mean, we've got this webinar going on because we're not the only ones thinking about child obesity. That's an issue that people across the world are trying to tackle. And what we don't want to do is try and reinvent the wheel. We want to build on the evidence that's out there, but also add to it. So I think what we particularly look at as how do you translate a broad theoretical evidence base into local practice? What needs to stay the same, or what can stay the same and therefore be replicated again and again, but what really needs to look different depending on context, and how do you design for that? The second thing we look at is what are called shared value. So we've tried to look at what are the different things that affect the food environments that children and families spend their time in. Who are the different decision makers controlling those things? And if possible, can we partner with some almost early adopter decision makers to test things that not only have impact, but also work in the context of those decision makers' worlds? And I'll talk a bit more about specific projects to give you more a sense of what I mean by that. And the third principle we have is to take a really agile and user-centered approach to project development. So completely agree with colleagues from UNICEF in that I think things work really well when the people who those initiatives are aimed at are really a major part of the process of creating those initiatives, from design through to implementation and evaluation. So in everything we do, children and families always take centre stage, but also whoever we're kind of designing with or designing for, whether it's a school, we try and have school leaders in that context as part of it to really understand their user perspective and how initiatives can actually work for them in their implementation. And in terms of agile, I guess our principle is to try as far as possible to get going and iterate as we go. So we try and set up evaluation that helps us learn as we go and helps us adapt as we go as well. So in practice, what this means is that we have quite a diverse and growing project portfolio in our programme, and it's diverse in quite a few different ways. So as I said, we focus on projects that in the first instance are trying to affect different types of settings, so homes, school and food environments, and street environments, so high street environments. They're also diverse in terms of their geographic scope, ranging from projects which have a kind of a small local neighbourhood as their scope of activity, up to national level projects. They also vary in the type of partner, ranging from community groups led by local citizens, up to policymaker partners such as City Hall, to corporate partners such as supermarkets, and a range of others. So it's a diverse portfolio, and I think that just speaks to the diverse system of things that need to change in order to make an impact on child obesity. So if we could move on to the next slide. So I'm just going to go through 4 examples of projects just to give you a bit more of a flavour of what all this means in practice. So we've got one project where we're building what we've called a health space in a local community just down the road. The area is about 500 metres in circumference. The partner is a really brilliant charity called Oasis, whose mission is to improve youth outcomes. And they run a primary school, a high school, a range of community projects in this area. They have a model where everything they do is built with local residents and led by local residents as far as possible. So a brilliant partner. And what we're doing with them is designing, testing, and hopefully demonstrating a neighbourhood approach to tackling child obesity. So what we did was we brought them the evidence base of what works, or what is known to have worked, or what's been tried and tested in changing food environments, particularly in schools and also in street environments. And what that looked like was almost like a menu of options with a range of things, which had a range of kind of amount of evidence behind them. And then what Oasis did was themselves and the broader community looked at that and prioritised and designed local versions of initiatives from that list. We're adding a few ideas of their own, new ideas as well. So basically built a programme of a lot of initiatives which together are trying to tackle child obesity in that area. Within that area, the specific population they're trying to ultimately affect is their school population, which has a relatively high rate of child obesity. So that's the kind of sort of central measure, I suppose, they're trying to get at through this range of initiatives that are trying to change the food environment in the area. And I guess our vision for this is, in the first instance, to scale nationally. And what's brilliant with Oasis is they themselves have a national network of these community hubs, many of which have schools in which they run. I suppose the next scaling route that we see is other chains of schools and other neighbourhoods. So if we go to the next slide. So this is a project we're doing with a membership body called the Consumer Goods Forum. They represent, I think it's the top 100 global brands, global consumer brands. So that includes the major supermarket brands in the UK, along with a few major food manufacturing brands. What we're doing with them is testing across our whole geography, so across Lambeth and Southwark, ways that supermarket stores can be made healthier or can be redesigned to incentivize much more healthier food purchasing. So again, what we did with them was bring them the evidence base and what that might translate to into a menu of options applicable to store environments. And again, what they did was prioritize and design in their local context. And, you know, it's quite interesting with this partner, what they're interested in measuring alongside impact is obviously kind of commercial considerations and how these things affect those. Again, with the idea that hopefully experimentation in this local area over 2 years would lead them to pinpoint things they can scale over their national store branches and maybe even international. So if we could go to the next slide. So this is a project or a partnership we have with the City Hall, with the Mayor of London. Again, partner with a different set of levers, policy levers. What this is essentially a London platform which the Mayor and ourselves hopes will drive action across the city to tackle child obesity. Very similarly, what the platforms try to do is to pull out some high-level priorities based on the evidence base and based on practitioner experience in London about the kind of, if you could change these 10 things, that would probably make a big impact on the food environments in the city. So they're trying to use, with us and ourselves, use that platform to drive citywide action, which of course will affect our area within the city. And the next slide talks about a partnership we've got with an organisation called Share Action. So this is another way in. We see, we saw the Consumer Goods Forum project is working with food, retail and manufacturing brands. This is working with the investors of those brands, trying to use them as a route to influence them to improve and change their practice in a way that will positively affect food environments. And if I can go to the next slide, actually, and then 2 slides on, the 2 slides before this speaks to this one. So this is a partnership which we have with a organisation called Frameworks Institute, which is sort of a broader, almost communications partnerships, I'd say. When we were scoping this programme, what was really interesting to me was that what the evidence base was suggesting were key drivers and solutions to child obesity was almost in opposition to what public opinion thought that might be. So what was coming out from the evidence base was this strength of food environments as a driver to people's eating behaviours, and therefore as a driver on child obesity levels. When we spoke to people, just the public, and this, regardless of income, whether they themselves were obese, non-experts basically, I guess when they thought about child obesity, they thought about it often as an issue of really individual willpower and maybe individual knowledge, and therefore the solutions that they would come up with look quite different. So there's a lot of emphasis on kind of education initiatives and focus on that, and almost a bit of a kind of moral thing about parents, making bad decisions around what they were feeding their kids. And I suppose what that told us was that one barrier to solutions, getting going and scaling, is probably a communications barrier. And actually the way we talk about child obesity, and this is ourselves included, can sometimes reinforce this almost individualist thinking about the issue. So what we've done with an organisation called Frameworks is to design and test on quite a large scale communications framing of the issue that will help people think of this as an issue that needs kind of structural solutions, really, an issue of food environments. So the output of it is a communications toolkit for anyone talking about child obesity and trying to drive action in that area. And what we're now doing with it is trying to disseminate it and get it used by all the major communicators around child obesity in the UK. So that gives you kind of a flavour of the range of partnerships we have in this growing programme, which is aiming to add up to impact on child obesity. And we have some guiding principles for evaluating the impact of that. And to be honest, this was the absolute hardest bit of the programme, and just like all the other bits, it's something we're still learning how to do. I think what was complex about it was with child obesity, you're talking about a complex and changing system where everything you do is interlinked with other things. You're talking about a huge range of activity that needs to be done, but almost with different kind of measures, different steps away or near to your end goal, which is reducing child obesity. So some principles that we have to help us navigate that is we seek to measure contribution, not attribution. And what we mean by that is we think it's our job to track the overall levels of child obesity in the area. I mean, we're lucky in that there's a national data set which tracks that down to school level every year with all children aged 4 to 5 and all children 10 to 11. So we use that to kind of track overall child obesity levels. We also attempt to track the kind of cumulative impact of all our projects on eating behaviours and child obesity reduction. What we ask from projects themselves is to be very rigorous in tracking their particular impact on changing food environments. So, we have a theory of change about how all these different drivers are going to add up. And what we ask projects to do, and what we try and help them to do, is to see whether they've actually made what we thought would be their contributory impact to food environment change. We try and kind of work with partners to, I guess, reduce the burden that means for them in tracking, hopefully make measures and impact management useful for their operations themselves. And I guess that's the other thing to say, where, you know, we are attempting to have quite an agile approach, which means our evaluation has to be, whereas maybe not real time, but as near to real time as it can be, you know, try and give us some indication of progress as we go along, not just progress at the end. And if you go to the next slide. And yeah, this is just the kind of summary of the different ways we use our impact measurements. So we use it for ourselves to understand and refine our own program. We use it for ourselves and others to paint a kind of complete picture of what all our things are adding up to. And then we also use it to communicate to others, both about what we're doing, but try and communicate what change we think needs to happen as a result of our learnings beyond our own geography and beyond our own operations and sphere of control. So yeah, and then the next slide, please. So I hope that gives you a picture of what, of an example of what we're doing in one particular inner city area, trying to both make impact here, I think, on this issue of child obesity, but through that impact to learn and share with others, such as yourselves, about how this issue can be tackled. And if you're interested to find out more, here's 3 of our publications. That Families and Food one, if you click on that link, there's also a link to the video that was hoping to show a clip of, which gives you more of a sense of our food environments from the perspective of children and families themselves. Thank you.
Thank you very much for this very interesting presentation. We're going to now shift our attention from London to India, and I'm going to pass the mic to Dr. Goenka, who will be speaking on the built environment and levels of physical activity and obesity prevention in India.
Oh, thank you very much. I'm Shefalika Goenka. It's a pleasure being here and presenting in this seminar. Thank you for the opportunity. And my presentation is going to be extremely different. I'm going to be trying to be as brief as possible, given in the interest of time. Built environment, levels of physical activity and obesity prevention, lessons from India, how the context of India and other low middle income countries. So how the context of India and low middle income countries is different, and that needs to be taken cognizance of. So, as we know that more than 50% of the people worldwide live in cities. This is rapidly expanding, and it's projected to be more than 70% in the next 10 to 14 years. Next slide, please. Thank you. The built environment has a profound impact on the population physical activity levels. Interventions which change or impact the population physical activity levels also simultaneously decrease air pollution, decrease obesity, decrease other non-communicable disease, decrease the fossil fuel consumption, decrease the heat island effect, and therefore contribute to some extent to mitigating climate change. Next slide, please. Thank you. Science has unequivocally demonstrated the wide-ranging and robust benefits of physical activity for more than 60 years. Majority of these effects arise out of prevention of obesity, primary prevention of diabetes by more than 50%, hypertension, strokes, cholesterols, triglycerides by more than 20 to 30%. Next slide, please. It's rightly called as the miracle drug, as physical activity in daily living prevents a whole host of other diseases and conditions like osteoporosis, osteoarthritis, breast cancer, colon cancer, lower back pain, stress and anxiety by 15 to 30%, and also helps to tackle the key environmental and other health burdens. Next slide, please. We know sitting is a huge risk factor. All of us in our jobs end up sitting for long periods. People end up sitting in traffic jams and in travel too. However, we have a solution: 60 to 80 minutes of moderate to vigorous activity each day negates the wrong effects or the bad effects of sitting. Next slide, please. The evidence keeps pouring in that every minute of physical activity counts, whether it be of any intensity, moderate or vigorous intensity, much beyond the minimum recommended amount. The benefits keep rising, and every minute you sit less helps. This is the recent publication by Ekelund and Group in 2019 in the British Medical Journal. Next slide, please. 4 built environment factors have been known to be positively and linearly associated with higher physical activity levels in objective measurements in 14 countries. The most important being green parks within walking distance, within 0.5 and 0.5 kilometer radius from residents and workplaces, which are free, open to all, and of minimum size at least 0.3 hectares or more in size. High density of public transport, number of and bus stations, bus stops, net residential density or compact cities, more intersections. Number 3 and number 4, however, are different for LMICs, the low middle income countries, and that we will be looking at a little later on. As all these 4 points assumes the presence of wide usable pavements and a road traffic which is organized, which is not more than 2 lanes within cities wide. Next slide, please. The Lancet series on urban design and transport recommends 8 Ds of design. Density, cities should be more compact, which however is not the case for low middle income country cities, because here we are bursting at our seams with higher density, which in fact constricts the physical activity levels and increases morbidity. Increasing diversity is what is recommended for developed countries, where you have mixed land use, which again is completely opposite for low middle income countries. Distribution of employment, equitable distribution of employment across cities, destination accessibility, demand generation, so generating a demand for other modes of travel outside your own cars, more active travel, distance to public transport, and increasing the desirability of active transport. This we'll be delving into more detail. At the micro level, making active transport safe, attractive, affordable, desirable, prioritizing wide pavements and non-motorized cycling lanes. In fact, in low middle income countries, and we'll be dealing with the heat issues, we need periodic benches and water fountains, which also counter consumption of sugar sweetened beverages. This should be a mandatory requirement. In fact, a measure of development of a country is how well you treat and respect your pedestrians and other active transporters. That needs a lot of attention in low and middle income countries. Next slide, please. We need to ensure sufficient separation between pedestrians and non-motorized and motorized transport, preferably with greenery, green spaces, making neighborhoods safe, destination accessible. Policies also need to protect and support agriculture in urban and peri-urban settings. Lastly, schools, educational institutes and homes should be located away from high traffic zones. Next slide, please. We are following a cohort, a population representative cohort in Delhi. And what we find, the areas which are circled, blue is less and red is more. So people living in high density areas, highly dense areas alongside multi-lane highways, it's a very common phenomena here, have very low physical activity levels. And similarly, the same people have higher blood sugar levels. Next slide, please. This is unpublished data, please. Please do not cite. Similarly, people living in proximity, highly dense residential complexes and commercial complexes, alongside multi-lane highways, people living there, their systolic blood pressure was an average 175 to 224, which is really high reds. And those people living more in the interiors, this is again the cohort from Delhi, have lower blood pressures. Many governments have established noise standards with the aim to protect citizens. However, that it's probably not even being looked at in low middle income countries. That needs to be addressed. Next slide, please. Public transport is a known augmenter of population physical activity levels. In fact, in a review by Russell et al., there's increased walking time from 8 to 33 minutes per day in those who use public transport. It also saves fossil fuel, lowers carbon emissions. All public transport needs to be age and disabled sensitive, climate sensitive, and in the low middle income country context, should restore the dignity of the public transport users in all human habitations. Next slide, please. Where you see a very high level of stunting, the slide which was shown by my colleagues in the first presentation. And you see 38% of the children under 5 which are stunted, 21% are wasted, 36% are underweight. India also has the third largest number of obese people in the world. 20 to 29% of private school children in cities in India are obese, which is beyond even US standards. And 10% of these overweight and obese children have some kind of dysglycemia. So we are seeing the complete double burden of obesity on one side, undernutrition on the other side. Next slide, please. What are some of the barriers to being physically active in India and other low middle income countries which are very similar? Inappropriate city planning or not any regard to health planning in cities, disappearing green spaces, urban forests and parks, high temperatures. We are going to be dealing with this in high dust levels a little later. High temperatures are it's a huge barrier in all the low middle income countries. High density of mixed land use, land mafia, increasing density of the built environment, over construction, illegal construction and over commercialization. So where you have congested factories operating in residential areas where children are playing outside with toxic chemicals being spoofed out. Pavements are vanishing, usable pavements, non-friendly crossings, sitting for long hours in travel, and compromised safety, absence of last mile walkability, even when you use public transport, and safety concerns. Next slide, please. High temperatures. Most of the low middle, of course, Europe this year also faced a huge burden of global heat. But most of the low middle income countries from time immemorial have been facing scorching heat most of the year around. About 7 to 8 months a year around, the temperatures could vary between 24 to 47 degrees Celsius for majority of the months. And this has been increasing with every year. Next slide, please. Mortality rises by 2% for every degree rise beyond 36 degrees Celsius. This was a study which was done by our group. And it increases further when the minimum temperature rises beyond 26 degrees, with the maximum being 36 and more. In fact, in a recent World Bank report, they have said that high heat is going to have a major negative impact on the health, economics, and standard of living in India. Next slide, please, and the various other Southeast Asian countries. To compound this further is the heat island effect, where trees alongside roads, which is a very standard way roads and pavements were constructed. You had lush green trees on both sides are being knocked down, are being cut down. And that's giving to an additional heat island effect of 3 to 12 degrees. Next slide, please. In a study done in Bangalore, when you have tree canopies alongside roads and pavements on either side, the temperatures, the air ambient temperatures are lower by 5 to 6 degrees Celsius. The road surface temperatures are lower by 25 to 27 degrees Celsius. The suspended particulate matters are much lower and the pollution levels come to acceptable limits. And those streets which didn't have the trees, the pollution levels were 50% more than the acceptable limits. Next slide, please. This is a bar chart which I've put across for this presentation. Is how green spaces And proximity, these were calculated through GIS-based studies, how proximity to green spaces over the lifespan and how it contributes to lowering diabetes, hypertension, mortality, cancer. So, and most of this is mediated through physical activity and obesity levels. So you have 14 to 20% lower coronary heart disease, 30 to 17% lower diabetes, 20 to 35% lower hypertension, mortality. Cancers are lower by 20%. Prostate cancers are lower. Refraction in children is lower. Next slide, please. This is a summary from various reviews which I've put together. High density in Indian cities leading to increased sitting time and more pollution. Mumbai, the total population of Mumbai, Kolkata, and Delhi, single cities, are 3 times as large as, say, the population of London, and double that of United Kingdom. And the population density could be anywhere from 20,000 per square kilometer to almost 100,000 per square kilometers. Mixed land use, congested small roofs, emitting a lot of toxic chemicals without piped water sanitation facilities. Next slide, please. This is another snapshot from our GIS of our cohort, which we have in Delhi, where people living, the area has been circled, it's a representative cohort, people living physical activity levels. The blue is low. Next slide, please. So road transport and designs are the leading cause of preventable deaths amongst youth globally. And 93% of these fatalities come from low middle income countries. It has been calculated that countries who don't invest in wide pavements, sidewalks, and pedestrian priority and other active transport facilities could eat away 7 to 22% of their per capita GDP growth over a 24-year period. Next slide, please. These are just pictures of how pavements need to be user-friendly and compared to pavements which are not user-friendly, which are a common sight in low middle income country cities. So people need to walk between parked cars and upcoming traffic. Next slide, please. Roads continue to keep getting widened, so pavements are removed or deconstructed, and then people need to walk on the road, including school children. Next slide, please. Non-user-friendly crossings. India has therefore one of the highest rates of road traffic accident. There's also a loss of dignity when being a pedestrian. And safety comes first. It's not about the last mile connectivity, but last mile walkability. Dignity of the pedestrian has to be restored, and the way we design cities has to be more people-centric, health-centric, climate-centric. Next slide, please. What we have proposed is a framework convention on built environment and physical activity, which needs to be taken up by WHO and other UN countries, because the same interventions have multiple co-benefits for obesity prevention, lowering air pollution, climate change, sustainable development goals, disabled and age inclusiveness, and dignity and prevention of non-communicable diseases. Next slide, please. These interventions are also aligned to 7 sustainable development goals. Next slide, please. Inactivity has huge economic costs. Physical inactivity, the estimated loss is about $67 billion US. Diabetes, in addition, leads to 600 to 1,000 billion US dollars. Suboptimal blood pressure, one is losing 100 billion US dollars annually. Countries, especially the low middle income countries, squander about 5% of their GDP through road traffic accidents and injuries. NCDs are estimated to cost India 6.2 trillion USDs over 2012 and 2020. Prevention of obesity through physical activity and through built environment measurements provides a huge solution to this. Next slide, please. So when we have, these are just some pictorial encouraging and motivational slides, more shaded white pavements. These are from Delhi. So we have what is known as the Luton's Delhi or capital region zone, which is still maintaining some of its walkability. And when you restrict the motor carriageways, because when motor carriageways are more than 2 carriageways wide, they become threatening to pedestrians. Providing green spacing, making walking comfortable with green canopies on both sides, we have less obesity, less diabetes, and a whole lot of chronic diseases, and less heat. Next slide, please. City planners can prevent obesity, steer population's health, economic savings, and the environment. Next slide, please. So I'd like to, this is the second last slide, end by a quote from Mahatma Gandhi. The difference between what we can do and what we are capable of doing would suffice to solve most of the world's problems. Next slide. Thank you. I just thank my team and mentors and stakeholders. Thank you. That's all from me. Over to you. Thank you very much.
Thank you very much. It was really interesting to have a perspective also from India. I'm going to quickly pass the mic to my colleagues, Margot and Leslie. We have just a few minutes left.
Yeah, so very briefly, we at World Obesity have developed a policy briefing, and in the purpose of time, we are just going to present some of the key recommendations that through our research that is available in the policy dossier that's online, have developed and just updated today and is available for to read online as well as to download. So I'm going to let Leslie present some of the key recommendations that we have formulated.
So yeah, based on some evidence from systematic review, cost studies, case studies, government guidelines, past and current projects, World Obesity Federation had identified the following considerations to support the successful implementation of community or city-level obesity interventions. So in first place, we encourage to undertake a situation analysis of the current health situation by identifying the specific strengths, weaknesses, opportunities, and trends, and including the root causes and effects to provide an evidence-informed basis for responding to the health needs of the population. This should include the health statistics, local policies, laws, and relevant academia research. Also, another one that is very important for us is to use frameworks and theories. For example, you can use the logical framework, the theory of change, the behavioral change wheel intervention design, and there are just to mention some of them. And it really doesn't matter which one does you choose, but it is very useful that you adopt one since the beginning, because they will help you and give you the path when developing and implementing new interventions. We recommend to adopt an integrated approach. This means that health should be integrated in spatial and financial planning strategies at all times. While most individuals and governments are aware of the current rising obesity epidemic, action is still required to bridge the gap between awareness of the problem and practical implementation of necessary lifestyle changes. Planned multi-sectoral and multi-level interventions should therefore focus on generating changes in the different determinants of health. It is also very important to engage a wide range of stakeholders, but safeguard the process from conflict of interest. All these different stakeholders should be involved in the elaboration, implementation, and evaluation of interventions to address the obesogenic environment. And in this case, political engagement is key to ensure the legal frameworks that promotes and protects health, and in consequence, successful implementation of interventions that guarantee healthy environments. And another key point is the partnership with academic institutions, which offer great potential for developing evidence-based research. And last but not least, we recommend to ensure that the interventions are going to be sustainable.
Thank you very much, Leslie, for these recommendations. And as I mentioned previously, these are all available on the policy dossier page on the World Obesity website.
So right now, I really wanted to thank you all for your time. I hope you found the webinar as useful, interesting, and inspiring as I did. I know we had a couple of questions during the presentations. Unfortunately, because of a lack of time, I'm not going to be able to ask them now to presenters, but please do feel free to email Margot at the email address that you can see on the screen, mneveux@worldobesity.org, your question, and we'll make sure to reach out to the presenters and we'll get back to you with your answer. Thank you very much for your time today.